Hello, this is ECG case of the week from Fox-Terrier. Look at this ECG. Press pause and try to make a conclusion in comments. In the end of this video, we will describe the electrophysiological mechanism of this disorder. So let's go to explanation. The first question for this ECG is who is the pacemaker of the heart, sinus node or not sinus? For this we need to find P-wave firstly in second standard lead and then in other leads. There are no P-wave in any lead that we have. According to this, rhythm is not sinus. The next question is, does this rhythm regular or not? For this step we need to check values of RR intervals and compare it to each other. Look, paper speed is 25 mm per second. The first RR interval is equal 1.76 second. The next RR interval is 1.8 second. We see that RR interval is approximately equal to each other, so rhythm is regular. Next step is heart rate calculation. For this we need 60 divided to RR interval in seconds. So heart rate is 33 beats per minute, is severe bradycardia. The next question is how is the mean QRS axis oriented. For this, let's find the maximal R wave and biphasic complex in extremity leads. The maximal R is in second standard lead, and AVL has a near to biphasic complex. After this, we use the hexaxial diagram for determining the mean QRS axis. Maximal R is in second standard lead. Biphasic complex is in AVL. Biphasic complex should be at right angle to mean QRS axis, so mean QRS axis is plus 60 degree, which is normal electrical position of the heart. After this we check all wave segments and intervals. There are no P-wave and there are no isoelectric line. But instead of P-wave we have a lot of regular deflections, which looks like sawtooth. So we will call it sawtooth waves. All of sawtooth waves have equal morphology and duration. Let's check the rate of these waves. For this, firstly measure the interval between the sawtooth waves. The interval is equal 0.28 second. And now we need 60 divided to this interval in seconds. The rate of sawtooth waves is 250 beats per minute. Absence of P-wave and isoelectric line. Presence of sawtooth waves with fast rate. This is criteria of ATRIAL FLUTTER. So also we can call sawtooth waves F waves. But let's evaluate the QRS complex. The width of QRS complex is 0.60 second, which is high. Look at leads V1 and V2. QRS complex here has an M-like morphology and negative T. Also in V6, first standard lead, and AVL, we see widest wave. These changes are common for right bundle branch block. Now look at relationship between sawtooth waves and QRS complexes. We see that slow regular QRS complexes interrupt flutter waves in random manner. As a result is that ventricles activates independently from atrial flutter because of complete AV block, and pacemaker of the ventricles has infranodal location because of wide QRS complex and slow rate. The ACG pattern of atrial flutter or atrial fibrillation with complete AV block called Frederick syndrome. So why it is echo? Let's start from atrial flutter. Atrial flutter defined as a macro-re-entrant atrial tachycardia. The basic principles underlying reentrant excitation are shown in a schematic diagram of ring of excitable cardiac muscle with a central unexcitable region. Conduction impulses are indicated by arrows, but this conduction is not enough for reentry. For complete reentry, unidirectional conduction block should be present. In this case, excitation can go only in one direction around the ring. In the conduction in block region is restored, it means refractory period of this region has ended. At the time when excitation arrives, excitation can re-entry in this region from the other side and all circulation of excitation around the ring repeat. Atrial flutter can be typical and atypical. Typical atrial flutter sustained by macro-re-entrant circuit in the right atrium. And this is the most common form of flutter. It has 90% cases. Specific structural features of this chamber form the circuit. Upper border of the reentrant ring bounded by superior vena cava. Left wall formed by interatrial septum wall. Lateral border is free wall of right atrium. And lower border is inferior vena cava. Inferior cava tricuspid isthmus is bundle of atrium muscle between atrioventricular valve and orifice of inferior vena cava. It has crucial role of typical atrial flutter. This is commonplace for conductional block. Typical flutter is further subdivided into counterclockwise flutter and clockwise flutter. Counterclockwise flutter is caused by rotation of reentrant impulse around the tricuspid annulus in counterclockwise direction. Clockwise flutter, also called reverse typical flutter, is caused by rotation of reentrant impulse around the tricuspid annulus in clockwise direction. When the impulse goes through the inferior cava tricuspid isthmus, we have a plateau phase of F wave on ACG. After this, we see ascending passing on the septal wall. And the last part of circle is descending passing through the lateral wall of right atrium. As a result of one reentrant circle, we have formation of one sawtooth on ACG. Inferior cava tricuspid isthmus is the weakest part of reentry circuit. It means more vulnerable for management. This kind of atrial flutter called isthmus dependent. So in our case we have typical isthmus-dependent counterclockwise atrial flutter. With third degree or complete heart block, no stimuli are transmitted from the atria to ventricles. Interruption of electrical conduction can occur at any level starting from the AV node itself down to the His bundle and its branches. If the block is in AV node, the ventricles are stimulated normally by nodal pacemaker below the point of block, and the QRS complexes are narrow. By an infranodal pacemaker usually producing wide QRS complexes. As a general clinical rule, complete heart block with the wide QRS complexes tend to be less stable than complete heart block with narrow QRS complexes, because the ventricle escape pacemaker is usually slower and less consistent. Frederick syndrome is a combination of atrial fibrillation or flutter with complete atrioventricular block on ECG. If you like the content, press like and subscription buttons. Have a good day.
Here we go.